Here's why hypermobile people should not do static stretching and what a static stretch even is. So there's a dynamic stretch and a static. Dynamic means like while you're moving, walking lunges, kind of walking knee to chest. There's also a static stretch, which is just like hamstring stretch, reach and hold. If you are holding a lengthened position, holding a stretch, that would be considered static. So why do we stretch? We feel tight. We feel like the muscle is shortened, the muscle is stiff and tight, and we need to lengthen it. That's what our usual thought process is for stretching. So we hold a static stretch for a long time, we lengthen the muscle, but then for some reason we just keep having to stretch and stretch and stretch, and it doesn't get better. In fact, a lot of times it gets worse because we don't need a lengthened muscle. Our muscles are plenty long. We need them to actually become shorter, and we can accomplish that with strengthening. So then what are we feeling when we're feeling tight? It's more likely neuromuscular, it's likely muscle guarding, because we are weak and unstable. The tightness is actually protective, and we're getting rid of it. So then, of course, you're going to have more pain. So if we can strengthen it, and if you're craving that sensation, there's other ways we can accomplish what you're wanting with a stretch. You can use any modality that you would like. Roll it out, massage it, give your body some feedback. You can take it into a somewhat lengthened position, or you don't even have to go that far, and do like a nerve glide with it. So for example, for your hamstring, you can sit on the floor. Instead of reaching and holding, you can kind of lean a little bit and then actively pump your ankles up and down. You can even do it with your knee bent, and it can go a long way. So if you're hypermobile and you feel tight, dynamic stretching, mobility work, anything you are moving through to improve is a much better option than static stretching. Drop your questions below.